we saw the different techniques of nucleus exploration. I think Dr. Subodhi just mentioned various techniques, and I'll be adding one to it. It's called little expulsion, or you can it's an endo expression of the nucleus. Basically, it's a surgical video. Once you make the adequate incision, capsular access is one of the most important step of cataract surgery. I use a technique of capsular marking with air bubble CCC. Capsule stained with Lipan blue. The size of the capsule is very important, especially with SICS, because now most of the training starts with phaco, and we all are getting used to smaller axes. Though they are good for your phacoemulsification, sometimes they are inadequate for SICS, and I've seen most of the complications occur because of smaller size of axis. So sizing your axis is very important in SICS, especially if you have a harder cataract. So take time on your axis. Staining is very important, and as I showed, use an air bubble assist technique so that you get a marking onto the cornea of the expected or the desired size of that axis. So here I am making an axis adequate for that nucleus. So this is a hard nucleus. You get the nucleus out of the bag by, this is the cartwheel is the best technique in my hands. What I am trying to show is how you minimize the instrument inside the incision so that you can keep your incision to the least possible. So you engage the nucleus into the incision and then you express it out by pushing it from behind. So this is an endo expression of the nucleus. You can see any side of the nucleus will come out. Now here, over a period of time, we have modified the techniques. Once you rotate or dial out your nucleus out of the capsular bag, what we do is we now use our routine BSS or irrigating fluid. We will be engaging the nucleus into the incision and to pressurize the chamber, because to get the nucleus out, you have to pressurize the chamber. To pressurize the chamber, we are using normal irrigating fluid. So once you pressurize the chamber, the nucleus will come out easily with little manipulation. So we are not using the main incision. That keeps the incision to the minimum, because as we saw in the previous and DNR, size of the incision is important. That will restrict your astigmatism. This is in a white cataract. Again, you rotate or dial the nucleus out, judge the size of the incision, and once you feel the incision is right for the nucleus to come out, engage the nucleus in the incision and get it out. So any kind of nucleus you can manage with this technique of endo expression or little expression, and you can continue with the same instrument. So you do not use any instruments through the main wound. What we're trying to show here is you use the instruments other than in the main incision. So you can continue with your cataract surgery, your nucleus, after the nucleus expression you can continue with your eye and your lens implant. This is a small pupil, sometimes challenge for an SICS surgeon. But again, if you make an adequate capsular access, things are easier. Here be gentle on your hydro procedure, because you don't know, sometimes overinflation can cause PC rupture. though the pupil is small, you can manage with this technique of dialing out the nucleus. You can see it's quite large, and then we express it out. We just debulking, getting the loose cortex out. So quite a large nucleus. Again, we use a technique of hydro-expression or endo-expression. We are pressurizing with the irrigating fluid and pushing out the nucleus. So we keep minimum manipulations inside the incision, and we continue with the same instruments that we use for nucleus expression. So one more addition to nucleus expression technique is quite simple, doesn't require any additional instruments, and redoable. Thank you.
Thank you, Tekawade sir, for showing that video and explaining to us in great detail.
Excellent videos.
Thank you. Thank you.